Welcome to Med-Surg Mini number 8, where we'll talk about B-cell deficiencies. A B cell functions through initiating the humoral immune response and producing antibodies. It also helps with differentiation of antibodies or immunoglobulins in response to antigens. It develops into plasma cells, and disorders of B cell function are X-linked agammaglobulinemia, common variable immune deficiency, selective immunoglobulin A, and immunoglobulin G subclass deficiency. Common symptoms of B-cell deficiencies include fever, behavioral changes, symptoms associated with lung infections, increased respiratory rate, rashes and lesions, reddened conjunctiva, eye drainage, pulling at the ears indicating that there's ear pain, and increased temperature. B-cell function continued includes nursing problems related to dysfunction, which would be risk for infection, social isolation if they have to avoid large crowds, and impaired self-esteem, especially if the dysfunction causes any rashes or skin irritation. Our common treatment is going to be things like infection prevention, safe food handling and storage. We can provide them with prophylactic antibiotics or IVIG, and patient and family education and support groups. The first deficiency I want to talk about is X-linked agammaglobulinemia, also called Bruton's agammaglobulinemia or XAB. This is an X-linked recessive gene, and it's a mutation of the BTK gene. So this is something that is inherited, and it's 50% of B-cell deficiencies. The pathophysiology is that Bruton's tyrosine kinase, which usually triggers B lymphocyte differentiation, fails to appropriately act. So we don't have the typical development of white blood cells that we would expect, and we don't see any B lymphocyte maturation to produce antibodies. This lack of Bruton's tyrosine kinase's ability to communicate with immature B cells, like I said, prevents them from producing antibodies, so we have limited or no antibody response, and then we see increased infections, especially bacterial. The symptoms of this X-linked disorder includes increased acute infections, especially in the ears, the eyes, the lungs, the skin, and the central nervous system. It can also lead to chronic infections in the lungs, the sinuses, and it can lead to meningitis and sepsis. We can also see increased autoimmune diseases and cancer development and increased susceptibility to viral infections. So they're more likely to develop hepatitis, polio, and enterovirus. Diagnostics would be gene mapping and genetic testing. This particular disorder has what we call mosaic expression. So if someone is a carrier for this disorder, they may have partial symptoms. We can also look for B lymphocyte surface marker assays. Treatment for this would be immunoglobulin therapy or IVIG therapy every 3 to 4 weeks. We could provide them with prophylactic antibiotics and provide them with immunizations. One thing with these disorders is if we do provide an immunization, the live virus is contraindicated. Other B-cell deficiencies include common variable immune deficiency, which is similar to the disorder we just talked about, but less severe, and it impacts IgA more than IgG. There is a genetic basis, although the specific gene is unknown, and it causes a lack of B-cell differentiation into plasma cells. Typical onset is between 15 and 35 years of age, and it increases the risk of autoimmune disorders, interstitial lung disease, hepatitis, non-Hodgkin's lymphoma, gastric cancer, and hepatitis. The treatment is the same as XLA. Selective immunoglobulin A is another disorder that blocks the differentiation of B cells into IgA. The diagnosis is often over the age of 14, and there is a genetic basis, but again, that's unknown. Knowing patterns of how it's passed on, it is suspected to be autosomal. In this disorder, individuals commonly experience hypersensitivity reactions to immunoglobulin A administration. So if someone is receiving blood therapy, they need to have washed erythrocytes or blood from an IgA deficient donor. And then lastly, we have our immunoglobulin G subclass deficiency. In this particular disorder, it affects one of the Ig subtypes, but not the number of IgG immunoglobulins overall. The symptoms are going to be dependent on what type of IgG subtype is affected, but typically we'll see higher risk for sinusitis, otis media, and pneumonia. And that wraps up our discussion on B-cell deficiencies.